Osteochondritis dissecans, often abbreviated as OCD, is a condition that can produce significant discomfort, particularly in athletes and active individuals. Today, we'll dive deep into what osteochondritis dissecans is, its causes, symptoms, diagnosis, treatment options, and potential impacts on daily life and sports activities. Osteochondritis dissecans occurs when a small segment of bone and the cartilage covering it become disconnected from the surrounding healthy bone. This process disrupts blood flow to the area, leading to necrosis or death of that segment of bone. The most commonly affected areas are the knee joint, but OCD can also occur in the ankle and elbow. The condition usually presents itself in adolescents and young adults, particularly those involved in high-impact sports like basketball, soccer, and gymnastics. The exact cause of OCD isn't entirely understood, but several factors may contribute to its development. Repetitive trauma or stress to a joint is often thought to be a significant factor. All those high-impact activities put stress on the joints, and when combined with genetic predispositions, it can increase the risk of developing this condition. Hormonal factors and disruptions in blood flow may also play a role. Now, let's discuss the symptoms. Individuals with osteochondritis dissecans often experience joint pain that worsens with activity and improves with rest. Swelling, tenderness along the joint line, and a limited range of motion are also common. Some may experience locking or a feeling of instability in the joint, particularly if the fragment detaches and floats around in the joint space. Diagnosis begins with a thorough medical history and physical examination, where physicians assess the symptoms and perform tests to evaluate joint stability and movement. Imaging studies are crucial in confirming the diagnosis. X-rays can reveal changes in bone structure, while advanced imaging techniques such as MRI provide a clearer view of both bone and soft tissue, revealing the extent of any damage to the cartilage and identifying if a loose fragment is present. Once diagnosed, treatment options vary depending on the age of the patient, the size and location of the lesion, and whether the fragment is still attached to the bone. In many cases, conservative management is the first line of treatment. This usually involves reducing physical activity and resting the affected joint, alongside physical therapy to improve range of motion and strength. Anti-inflammatory medications and ice can also help alleviate pain and swelling. If conservative treatments fail or if the lesion is more severe, surgical options may be considered. Arthroscopic surgery is often performed to either reattach the loose fragment or remove it, ensuring minimal disruption to the surrounding tissues. In some cases, surgeons may opt to fill the defect with bone grafts or cartilage repair techniques to enhance joint healing. Following surgery, rehabilitation is crucial to return to previous activity levels and ensure the best long-term outcomes. Now let's talk about prognosis. For many, especially younger patients, the prognosis for osteochondritis dissecans is favorable, particularly if the condition is caught early and treated appropriately. Many individuals recover fully and can return to sports and other activities without lasting effects. However, in some cases, especially if left untreated or inadequately managed, OCD can lead to chronic pain, joint instability, and potentially early-onset osteoarthritis. It's important to emphasize the role of prevention. While not all cases can be prevented, individuals engaged in high-impact sports should focus on proper conditioning, strength training, and good techniques to minimize stress on joints. Periods of rest and recovery are equally essential to avoid overuse injuries. In conclusion, osteochondritis dissecans is a manageable condition, especially with early detection and appropriate intervention. If you or someone you know is experiencing joint pain, it's crucial to consult healthcare professionals for a timely diagnosis and treatment plan. Remember, understanding the condition is the first step toward managing it effectively. Thanks for watching, and if you found this information helpful, please like, share, and subscribe for more health-related content. Stay active, but also stay safe.